Hi, my name is Cari. I'm a nurse that works in Dr. Tomaszewski's office in the Door Orthopedic Center here at Door County Medical Center. If you're seeing this video, it's probably because you've either scheduled a surgery with us or you're planning on scheduling a surgery. And this is just a gentle reminder, I guess, because once we sign you up, we might not see you for a period of time again before your surgery. So if you have any last-minute questions about any of the things we're instructing you to do, this might help. You're going to be scheduled that surgery. You will be given a bag, which you're going to have some prep cloths. You're going to be having a ice pack, and then there'll be a folder. The folder will have a little bit of information about whatever procedure you're having, whether that be a carpal tunnel release, a surgery on your shoulder, whatever surgery that is, outpatient surgeries, you're going to be giving some of this information. We really want to focus on the preps, I guess. The prep class that you're going to do the night before surgery is an important thing. It's called nose to toes, and it's something that's been proven to keep down infection in any incision that we make when we're having a surgery for you. So we find it beneficial to do the nose to toes because there's bacteria that lives all over the body, and this reduces your risk of any infections as you come in. Depending on your surgery, you'll also have instruction on any durable or medical equipment you might need. So if you're coming in and you're having a knee scope with us, you may need to get some crutches or a walker prior to that. If you're having a shoulder surgery, we encourage you to consider having a recliner that you might sit in. All of these things are to help transition you from your surgery to home safely and with any of the medical equipment you might need. If you have an employer that requires any paperwork filled out, we always discuss at those appointments that you should have that to us about a week prior to your surgery, so we do have enough time to turn around that paperwork, have it signed by the doctor, and get it back to your employer so that there's no delay in any type of payments you might be getting if you have short-term disability or some sort of plan such as AFLIC it might be. So we ask you to bring that in, we'll get it filled out, and you'll be all set to go. You will need a driver to and from your surgery. That's also listed here. And then, depending on if we're sending you to your primary care provider for a pre-op physical and clearance to have that surgery, or if Dr. Tomaszewski is just saying that he feels like you're at a low risk and don't need to see someone, you're going to be given instructions on the medications you take the morning of surgery. The other thing we ask that you stop doing prior to a surgery is 7 days prior, you're going to stop vitamins, supplements, and NSAIDs. NSAIDs include ibuprofen, Aleve, prescribed things such as meloxicam. All of these things do thin your blood, so what we do is ask you to stop them 1 week prior. If you're in need of something for pain, that 1 week leading up to surgery, Tylenol is considered the safe medication that you can take because that does not thin your blood out. Your primary care provider will maybe instruct you a little bit different if you're somebody who's chronically been on those things, but those are all covered once we get a note to your primary care provider or they weigh in with a pre-op physical, which we might send you for. One thing that's very important is that prep cloth we talked about. We're going to give you those instructions. You'll be able to read them word for word, but we like to go through them too because sometimes there's a bit of confusion. So what you're going to do the night before surgery is take a shower with an antibacterial soap, and then you'll start the process. You're going to be given cloths where there's 3 packages, and there's 2 cloths in each package for a total of 6 cloths. So after you wait that hour after that shower, you'll bring out cloth number 1. You're going to wipe down your chest. The cloth will get thrown away. Cloth number 2 comes out. You wipe down your arms. You throw it away. Cloth number 3 you take out, you wipe down your legs, and then you throw it away, and so on until you're all through the 6 cloths. Then we ask that you go to bed with clean sheets, clean pajamas. In the morning you're going to get up and you're going to shower again, depending on what day your surgery is. Might be an early arrival, might be a Thursday surgery where it's a little bit later, but we still ask that you take another shower, and then when you come to surgery, the nurses are going to do this a second time. So we call this a 2-step process. You're responsible for the night before, and then the nurses do it when you come in. I always tell folks too, if you do it at home the night before and you find yourself very itchy or you have sensitive skin, we want you to get back in the shower and wash it off. The reason for that is if you found it to be so itchy or so irritating to your skin and you're clawing at yourself and there's any openings where bacteria might have gotten from a nail or the scratching, your surgery could be potentially delayed. So it's very important you get in, wash it off. You're gonna alert the nurses to that when you come in the day of your surgery, and then they may use another product or just forego the whole thing in general, depending on how severe that was for you. Now, when you have your surgery, you're also gonna be given the ice pack, the wipes, and then there'll be the folder like I discussed. If you're having a shoulder surgery with us, all the information is still the same. You're just gonna get a little bit more information. Because surgeries on the shoulder can be so technical and there's different procedures, it's not straightforward. We give you a complete guidebook. The instructions are exactly the same for those prep cloths, but there is an additional product that we have you start using. That product you start using 3 days before surgery. It's a bacterial type infection or bacteria that lives in the shoulder, in the armpit, that it's been proven that it's killed with this acne medication. So 3 days prior to surgery, and we always write down the dates for you because it can be a little bit confusing counting back 3 days, but you're gonna use this product in the morning. You put it on the armpit and arm that's affected. You leave it on for 3 minutes and then you wash it off. And you'll do those 3 consecutive days, not the morning of surgery. So that includes everything that we give you as you move forward with your surgery. When you come in the day of surgery, you'll also then be given instructions for when you go home. You'll be given an appointment date and time where you're gonna come back for whether that be suture removal, staple removal, or whatever your post-op is. And typically those are all done in a 10 to 14 day time frame after the date of your surgery. So that concludes everything that we're gonna give you to move forward with a successful surgery and all of the prep and the information that you'll get as you lead into that surgery. We would like to take this time to thank you for considering us for your orthopedic needs and any outpatient surgeries you may have coming up in the future with us.